Regular sleeping pattern improves metabolic health. Metabolic health is one of those key measures of health most people need but most people don't know about. And having a good night, it's more than just maintaining an ideal body weight or exercising regularly. Health professional, these 5 key factors define metabolic health, which directly relates to a person's risk for heart disease, diabetes, and stroke. This explains we need to look at metabolism beyond just body weight, an endocrinologist at New York Presbyterian and Weill Cornell Medicine. There has been a push to address obesity through public health measures, but this study shows us that even people who are a normal weight seem to be developing diseases that we typically correlate with obesity. Doctors say diet and lifestyle changes can help improve one's metabolic health. Quitting smoking, but there is one key factor that also helps promote metabolic health. It's sleep hygiene. Sleep hygiene consists of recommended behavioral and environmental practice that is intended to promote better quality sleep. Sleep hygiene should also be incorporated into improving metabolic health. That has taken a hit. Having a regular pattern of going to bed and waking up promotes metabolic health. A new study has examined the relationship between variability of sleep pattern and the development of metabolic risk factors in 2003 people between 45 and 84 years old. It found that for every 1 hour of day-to-day variation in bedtime or length of sleep, there was a 27% increased risk of developing metabolic risk factors. Previous studies have shown a link between insufficient sleep and higher risk of obesity, diabetes, and other metabolic disorders. This new study related video. Sleeping less than 6 hours a night can significantly impair your work performance via T+L.
Raindrop, drop top smoking, no cooking the hot pot. Fucking on your bitch, yeah, that. Looking up, open the park pot.